I am 4 days post-op from a lumbar facet cyst removal and a spinal fusion. I had it on Wednesday, and today is Sunday, so definitely 4 days post-op. So I thought I'd try to put together a little video just to talk about some things that might be of importance to anyone in the future who may need this type of surgery. It's very different having this type of surgery in Bermuda as opposed to overseas somewhere, because we don't have a spine specialist that is actually stationed here on the island. I have been dealing with back issues and recurrent spinal cysts for like 4 or 5 years, with the accompanying pain, numbness, claudication of my legs, where they just feel like they're just going to go out from underneath you. It's just been ongoing. So I would have to go into the hospital and get the cysts ruptured, drained, and then have cortisone injections into my spine. And you're only allowed to have like 3 of those per year. And I was using up most of mine. So I spoke to the spine surgeon. He flew in from Boston. So the first time I saw him was last August, and I wasn't feeling so bad then. I mean, I had recently had a spinal epidural injection. And he's like, well, you know what's going to happen when that wears off, right? I said, yes, I know. I'll be back to the same. It's not FML, it's FMA. It's not cool. It feels like someone else has a remote control and they shock you. And you don't know when it's coming, and it hurts so badly. And sometimes you feel like you can't walk, and you're like, I know I can walk, but you just kind of get stuck in slow motion, like, move my right foot, it's just a horrible feeling, and it's very difficult to explain if someone has never gone through the sciatica and all the other ridiculous pain that occurs when you have your nerves in your spinal column being compressed by a cyst and spondylolisthesis. And basically what happened is one of my vertebrae, L4, has slipped forward over L5, and that like puts a kink in the hose, and it will continue until something is done about it or not. So basically he would have to put the vertebrae back in alignment and use titanium rods and screws and to stabilize my spine. So anyway, not having our own spinal surgeon on the island has been an ordeal. And one of the reasons I decided to do this video is because, I keep thinking of people who are a little bit older than me. Like, I'm in my 50s. So if anybody who's like in their 60s or 70s and they have to navigate this spider web of confusion and annoyance, it can be really, anyway. So I spoke to the spinal surgeon last August, and he said he wants to put me on his schedule for the next time he's here, which should be March of 2023. I said, okay, fine. So I had to wait all that time. And then when it came time to start sorting out, okay, when is the actual date? When is he going to get here? It's very difficult because he operates in Boston, and then he has to find time to come here and to coordinate his schedule. But what happened is that we are still in a backlog of surgeries that haven't taken place because of COVID. We only have one hospital with 65, who knows if we have 55. I don't know how many people we have anymore. So I have to wait for the next census. So we only have one hospital. We don't have rehab places. So anything serious that happens to you on this island, you have to get flown overseas. But in order for me to get this surgery, because there were so many, I was informed that I would have to have it as an outpatient. Now, that raised a lot of eyebrows from a lot of professionals, family, and myself included, because it's not minimally invasive here in Bermuda. We probably don't even have the machines to do that. It's like a P-lift. It's like your back is going to be splayed open while he does all of his carpentry and ortho work in there. You're expecting me to have this surgery, and on the same day go home after a spinal fusion. People typically spend between 2 and 4 days in the hospital after surgery of this kind. But they wanted me to go home right after. And they said if they booked me as an inpatient and I got to the hospital and there were no beds available, because they said that's what the problem is, there are no outpatient beds, surgical beds. So if I got to the hospital and there were no available beds, they would send me back home. My clothes are filthy and I'm going to change them today and I'll explain why, whatever. So I had issues with that because I know they're doing more of these types of procedures, especially if they're minimally invasive, but this one was not going to be. So there was a whole hubbub about all of that. Anyway, when the surgeon flew in last Sunday, I met with him and he said, we don't even do these as outpatients in the States. So I'm going to advocate on your behalf and let them know, because of the hardware, you cannot go home that same day. You have to spend at least a day in the hospital, at least. I said, okay, fine. We'll see, because just because he says that doesn't mean that that's going to happen, because Bermuda is another world. So I get to the hospital and I checked in and the nurse called to take me back, and she said, oh, there's going to be a change in plans. It seems like your doctor, your surgeon, has requested that you stay in. I wonder why they booked you as an outpatient then. And I was like, I didn't even say anything. I was like, no, the story's too long, whatever. I was just very, very grateful for him. He's an excellent surgeon. He's got such a great bedside manner. Even meeting with him, like he's fellowship trained, and he's just very impressive in that respect. And he's very unassuming. Doesn't walk around like he's holier than thou. So anyway, I'm gonna stop part 1 right here and stay tuned for part 2, which is the actual surgery and what happened as a result.